In this brief video, I have some big news on current events and their impact on your Medicare Supplement Plan N. If you have a Medicare Supplement Plan N, or if you're currently researching Medicare supplement plans, this information will be important to you. So stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. My company is an independent insurance brokerage specializing in Medicare and retirement needs. We help people with their Medicare decisions in virtually every state of the country, and our services are free to you, the consumer. All you need to do is ask. For those who've watched any of my 40-plus videos or read my articles on the various Medicare supplement plans, you'll know a few things about how I approach advising people on their Medicare. First and foremost, there is no good or bad Medicare supplement plan. All Medicare supplement plans are good because they allow you to keep the benefits of original Medicare. You can see any doctor, go to any medical facility, as long as they accept Medicare. In addition, no insurance company has any say in your coverage. Medicare makes all the decisions. As you evaluate Medicare supplement plans, your goal should be to find the plan that you believe is the best value. The right plan for you is the one that meets your needs and your budget. After you know which plan is right for you, it's important to identify an insurance company whose prices are competitive and stable. All that said, as I make this video in late March of 2020, there are two new developments that will likely increase the value of Medicare Supplement Plan N. So let's take a look at these. First is a big change by Mayo Clinic and their Florida facility. Now, for people in Florida, one of the drawbacks of a Medicare Supplement Plan N has always been that Mayo Clinic in Florida has charged a Medicare Part B excess charge. Many people view Mayo Clinic as one of the nation's top cancer treatment facilities, especially for blood cancers. Unfortunately, the Mayo Clinic in Florida charged an excess charge for many outpatient services, and that would leave the Medicare Supplement Plan N policyholder liable for the extra 15% that was billed on most of the outpatient services. The good news is that Mayo Clinic in Florida no longer charges an excess charge. They now accept Medicare's assigned rates. So let me repeat that. Mayo Clinic in Florida, as of March 2020, no longer charges a Medicare Part B excess charge. They now accept Medicare assignment. The only state where Mayo Clinic still charges an excess charge is in their Arizona facility. So you can find this information by going to mayoclinic.org website and looking in their FAQ, their frequently asked questions sections. And I'll link that below. So this news is big on several levels. Obviously, it's big for Florida residents and those in nearby states who might wish to travel to the Mayo Clinic in Jacksonville, Florida for treatment. But it goes beyond that. It's an important part of a growing trend. To the best of my knowledge, Mayo Clinic is the last of the major medical facilities that were holdouts that charge an excess charge. There are a few doctors here and there, most definitely, and it seems to be fewer each year. But you see, Medicare penalizes doctors that choose to have a contract with Medicare that allows them to charge an excess charge. Medicare pays them less than those who accept Medicare assignment, and Medicare won't be their one-stop biller. This means that the doctor or facility that charges an excess charge cannot bill your Medicare supplement plan. In most cases, they ask you to pay up front for the service, and then you submit your bill to the supplement company for reimbursement. Not exactly consumer friendly. So Mayo Clinic's retreat from excess charges in Florida is a big deal. There are also forces within the insurance industry that are lobbying your state insurance commissioners to simply outlaw excess charges in your state. That's already the case in numerous states like Pennsylvania, Ohio, New York, and others. If each insurance commissioner would do the same, we can get rid of Medicare Part B excess charges coast to coast. That would really make Plan N a great value. So don't be afraid to write a letter to your state insurance commissioner asking that Medicare Supplement Part B excess charges be outlawed in your state. It may help. Now, before we move on, if you appreciate or find value in this information that I'm sharing with you, please hit the like button below and leave a comment. Also, subscribe so that you can see my 40+ other videos that I have on Medicare. And if you believe your friends would also find this information helpful, please share this video. Share it on Facebook or any other social media. Let me know if you like the information that I'm sharing with you. All right, that's the first piece of big news. The second piece of big news has to do with developments resulting from the COVID-19, the novel coronavirus outbreak. A couple of days ago, it's mid-March of 2020, the U.S. government announced an unprecedented expansion in telehealth services for Medicare. And this is going to impact both those on Medicare Advantage plans as well as those with Medicare Supplement plans. The announcement, and I quote, "Medicare patients can now visit any doctor by phone or video conference at no additional cost, including with commonly used services like FaceTime and Skype." Now, there are two parts as to why this is important. The first part is that telehealth is very likely to see a permanent boost in its availability and usage. The government is putting a lot of money into making telehealth meetings more available. Doctors and other healthcare professionals who've shied away are now breaking the ice and starting to use telehealth in their meetings out of necessity, and will find it easier to manage than they expected. And of course, it's a very efficient way of working with patients that have any infectious disease. It keeps the healthcare workers safe while providing a meaningful convenience for those that are ill. They no longer need to get in their cars and drive to an office and wait for an appointment to see a healthcare professional. As a result of this virus and the government's response, we're likely to see a lot more telehealth in the years ahead. It's a natural progression of using technology to become more efficient in business, and it reduces the risk of spreading infectious diseases. But how does this impact the Medicare Supplement Plan N policyholders? As likely you already know, one of the drawbacks, or it's a minor drawback, of a Medicare Supplement Plan N is that there's a copay of up to $20 per office visit. Now, these are visits with a doctor or a nurse practitioner for diagnosis, evaluation, and management. There is no copay for physical therapy or lab work, just doctor visits. Well, as you may have guessed, there's also no copay for a telehealth doctor visit. Let me repeat that. There's no copay for a telehealth doctor visit. When CMS published their guidelines for Medicare Supplement Plan N back in April of 2010, they published specific billing codes that were allowed for a copay. That way there was no confusion among healthcare providers. In Item 6 of the CMS, the Center for Medicare and Medicaid Services Guidelines, it specifically reads, "Would online telehealth or telephone services constitute office visits for the purpose of determining whether a Plan N subscriber is subject to the Part B coinsurance or copayment of up to $20? Answer is providers do not code these services as office visits, office consultations, or evaluation and management visits in their Part B billings. Therefore, those services would not be subject to the Plan N coinsurance or copayment." End of quote. So there you have it. As telehealth becomes more mainstream in usage, it offers the Medicare Supplement Plan policyholder a way to visit a doctor for evaluation or diagnosis and management without a copay. The fact that fewer medical professionals are charging an excess charge, along with the mainstreaming of telehealth meetings in the medical facility, in the medical community, makes me to believe that a Medicare Supplement Plan N is going to be an even better value in the years ahead. Please don't misunderstand me. All Medicare supplement plans are good plans. Choosing the right plan for you will depend on your personality, your needs, and your budget. But as you make that decision, consider what we covered in this video. If you'd like my recommendations for a plan and/or insurance company in your zip code for you specifically, please complete the quote request form below. Our services cost you nothing. In addition, you get our services in helping you with your Medicare claims and your benefits, and if you want to reshop in the future, you have an independent insurance brokerage on your side. Check out our 5-star ratings, get in touch with us. We'll be glad you did. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.